Hi, good morning, Henry. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. I'm Henry Dawson, one of the nurses looking after you. It's lovely to see you today. I hope you're feeling a little stronger and more comfortable. I imagine you're looking forward to getting back home, and it's completely normal to have a mix of excitement and a few worries as well. I've come to go through your discharge plan with you so that you feel confident about your recovery and know exactly what to expect once you're home. We'll take our time, and please feel free to stop me at any point if you have any questions or concerns. Before we get started, how are you feeling about going home today?
Thank you, Nurse Henry. I am happy to be going home, but I do have a few worries. Physically, I'm feeling a little stronger each day, although I'm still sore around the incision, which I suppose is to be expected. To be honest, one thing that really frustrated me while I was here was the visitor rules. My family wanted to spend more time with me and even bring me some home-cooked food, but they weren't allowed. I know there must be reasons for those rules, but at the time it felt quite upsetting. Now that I'm going home, I'm also wondering what I should and shouldn't be doing during my recovery. I don't want to do anything that could slow my healing or cause any problems, so I'd really appreciate some guidance.
Thank you for sharing that with me, Mihiraa. Those feelings are completely understandable, and I'm glad you told me. It's reassuring to hear that you're feeling a little stronger, and some soreness around the incision is quite normal at this stage of your recovery. I'm sorry the visitor rules left you feeling frustrated. I know it can be disappointing when your loved ones want to spend more time with you or bring you something comforting from home. The visiting hours are in place to make sure patients get enough uninterrupted rest, as sleep is an important part of healing. They also help us provide treatments and carry out ward routines safely and with as little disruption as possible. As for outside food, we have to be careful because, after surgery, we need to make sure patients are eating foods that are safe, appropriate for their recovery, and prepared according to hospital food safety standards. I know those rules can feel restrictive, but they're there to protect your health and support your recovery. Now that you're getting ready to go home, I'd like to see what you already know about recovering after your operation. Mihiraa, that will help me fill in any gaps and make sure you feel confident before you leave.
Well, the surgeon briefly mentioned I shouldn't be lifting heavy things, but honestly, everything was a bit of a blur. I remember him saying something about no heavy shopping bags, but I'm not sure for how long. And I know the wound needs to be kept clean, but I'm a bit confused about whether I can have a proper bath or not. That's really all I can recall clearly.
Thank you for sharing that. It gives me a perfect place to start. You're absolutely right on both points. Mihiraa, let me make the physical activity and wound care plan crystal clear for you. For the next 6 weeks, it's vital you avoid any heavy lifting, and this means anything heavier than a full kettlebell. This includes shopping bags, laundry baskets, or even grandchildren if they run to you for a cuddle. The reason is to protect the deep internal stitches and muscles that need to heal without strain. For your wound care, the key is to keep the incision clean and dry to prevent infection. So, instead of taking a bath where the wound would soak, you will need to shower. Let the soapy water run over the area, but don't scrub it, and then gently pat it completely dry with a clean, soft towel. This brings me to your pain medication, which is connected to all of this. You've been prescribed something to take home. The reason we advise taking it as prescribed is not just for comfort, but for better healing. The main goal is to prevent the pain from spiking in the first place. If you wait until the pain is severe, it's much harder to get back under control. A steady relief from the medicine will allow you to do 2 crucial things. It will enable you to move around gently, which is essential to prevent blood clots, and it will allow you to take deep, full breaths without sharp pain, which stops chest infections from developing. Think of it as a tool that actively helps your body heal. Speaking of which, it's just as crucial to know when to seek medical help immediately. If you experience a fever or chills, increasing pain that the medication doesn't help, skin around the incision that becomes increasingly red or hot to the touch, or if you start vomiting, you must call us or go to the emergency department right away, as these are all signs of possible infection. This is a lot of information, I know. What questions or concerns do you have now, Mihiraa?
Thank you, Henry. That makes me feel much more confident. Just to check, When should I seek medical help straight away?
That's a very important question, Mihiraa. Please seek medical help straight away if you develop a fever or chills, your pain becomes worse or isn't relieved by your medication, the skin around your incision becomes increasingly red, swollen, or hot, you notice any discharge from the wound, or you start vomiting or feel generally very unwell. These could be signs of an infection or another complication, and it's always better to have them checked promptly. Before you leave, is there anything else you're unsure about or any other questions or concerns you'd like to discuss? I want to make sure you feel confident and well prepared for your recovery at home.
Thank you, Henry. That's all very clear, and I feel much more reassured now. I don't think I have any other concerns at the moment. I was just wondering if I'll need to come back for a follow-up appointment and what will be checked during that visit.
Yes, Mihiraa, you will need a follow-up appointment in 2 weeks. At that visit, we will check how well your wound is healing, make sure there are no signs of infection, and see how you are coping at home. It will also be a good chance to discuss any pain, concerns, or questions you may have had since discharge. If anything changes before then, or if you become worried, please do not wait for the appointment. Get in touch with us straight away.
Sure,
I wish you a speedy recovery, Mihiraa.